To Thursday Roundtable. I'm very excited about our guest panel today. We're talking about something very important to the community, very important to all of us, and that's mental health programs that really make a difference to help our community. And so I've got three great panelists. They're all from the Harris Center, which, if you're not familiar and if you're not from this area, we're located in Houston, Texas, and the Harris Center is also in the Houston, Texas, and Harris County, and they do wonderful things for the community. But I think this is actually relevant for any community health organization throughout the United States. We can all kind of help share and receive ideas about how we can help the community better with some of these mental health programs. And so first I want to welcome on the show Jennifer Battle, who works at the Harris Center. Welcome to the show.
Thank you. Glad to be here.
Excellent. And then we also have Dr. Evanthe Collins. Welcome to the show.
Thank you so much. My pleasure.
And we also have Miss Evelyn Locklin. Welcome to the show.
Thank you. It's great to be here.
And what I'd love to do, just to kind of get us started, and those who are just now chiming in, let us know where you're coming in from, perhaps what city or state you're located in, or country, because I know we have sometimes we have worldwide visitors who visit us today as well. So let us know in the comments where you are in the continuum. Are you in the mental health profession? Are you in the industry? Perhaps you can pipe in with questions that you have, but we want to make this interactive. We will be reading comments throughout our discussion today. If we could kind of give us an idea, I know a little bit about it, but I want our audience to know about it, a little bit about the scope of the organization. Maybe we can start off with you, Jennifer. Talk about the scope and then what you do at the Harris Center.
Thank you. Well, the Harris Center is one of 39 what's called local mental health authorities across the state of Texas. We are one of the largest providers of public mental health services and intellectual and developmental disability services in the state of Texas, which of course makes us one of the largest providers nationally of those services as well. And my role at the Harris Center is to help get people access to care in whatever way that feels best for them. They can call, they can text, they can chat, they can walk in, whatever we can do to try to help people get connected to care is something that I'm excited about doing.
That's awesome. I'm noticing something here. I just got a message back that it's not yet live on LinkedIn. So let me make an adjustment here. Let's see. We are actually live. If you're watching, you're actually live on Facebook, it looks like, at the moment. And she says we're not quite online with LinkedIn. So we're trying to figure that out. Why is it not? Okay, so here's what we're going to do. We're going to this makes live so fun. We're going to reset here. And you guys did great, by the way. You guys did great. So we're going to roll with this. We're going to open it up on the other side here. All right, so we're going to do it that way. Here it goes. So you guys ready? You said you were born ready, right? Okay, 3, 2, 1. All right, welcome to Thursday Roundtable. We're really excited about today's show and our guest panel today. We're going to be talking about a very important subject to all of us, really, and that's mental health and how mental health programs are really making a difference in our communities. And so I've got a great set of folks here who are here to talk about that, great panelists here. And although you may be watching this from somewhere else in the world, you may be watching this from somewhere else in the United States, we're located physically in Texas, in Houston area or Harris County. And so we're going to be sharing some ideas that I'm sure is going to help you wherever you're watching this from if you're not in our area. But let me get right into the introductions here. And Joanne, you can let me know if things are back to normal. So we have Miss Jennifer Battle, who works at the Harris Center. Welcome to the show.
Thank you. Glad to be here.
And then we also have Dr. Evanthe Collins. Welcome to the show.
Thanks so much, Rollis.
And then we also have Miss Evelyn Locklin, who also works at the Harris Center. Welcome to the show.
Thank you. It's great to be here.
Excellent. Glad to have all of you. All right. So, yes, we heard everyone. So I love that. And so let's get right into it. The first thing, just to kind of give folks an idea of the scope of the Harris Center and what you're able to do in the community, give us an idea of the scope of the organization, Jennifer, and then tell us a little bit about what you do there.
Great, thanks. The Harris Center is one of 39 what we call local mental health authorities in the state of Texas. And we serve people who are in need of mental health support as well as intellectual and developmental disability programs and services. And we are the largest provider of those services in the state of Texas, which makes us one of the largest providers nationally. And my role is to do anything that I can to try to help people have access to our services in whatever way feels most comfortable for them. So telephonically, via text, via chat, people can walk in, whatever people need to do in order to feel good about reaching out for care.
Awesome. Love that. And Dr. Evanthe Collins, tell us a little bit about what you do in the organization.
So, Rollis, I'm like the poster child for the Harris Center. Okay, so I came on board over 25 years ago, really as a temporary grant writer for a position that was supposed to last for 4 months. And that was 25 and a half years ago. So I'm like the poster kid for like the phenomenal work environment that's offered at the Harris Center. So I'm that person there. But in my current role, I am the director of grants and state contracts. So really, I help the agency to secure dollars and funding that's necessary to serve our phenomenal families that we have the ability to serve. And we serve over 80,000 individuals and families every single year. So it's a phenomenal job. And we have some great staff to do that. And it's just a wonderful place to work at the Harris Center.
Love it. Love that. Okay. And then Evelyn, tell us about a little bit about what you do at the organization.
Well, that's a tough act to follow 25 years, but 20 years ago, I began at the Harris Center as a student intern. So I was actually finishing up my master's degree in clinical psychology. And so now, fast forward to 2021, and I'm the director of emergency services and residential programs. And so I get to help people who are in crisis. And so whether that be an intervention focused program or stabilization programs, and link them to ongoing services, including housing. So that's what I get to do.
Very good. And you know, your voice is very clear, Evelyn, but again, it's really hard to hear you. So I don't know if there's a way you can get a little closer, that we appreciate that. That may make a difference.
You can hear me now.
Okay. A little bit better. Yes. Okay, very good. So let's get in. I want to get into some of the programs and how they help the community. If we can, let's start off with you, Jennifer. Tell us about some of the programs that you could, because there's some fancy little abbreviations you guys have. It's almost like a different language inside the organization, but I want to kind of demystify some of that and kind of explain what it stands for and what you do with the community.
Absolutely. Thanks for asking that. You know, as part of our new employee orientation in some of my programs, we actually provide the staff a list of all the abbreviations. So I said, you can literally have an entire conversation here and never even use an actual word. However, we will not do that with people that we serve. Right. So whenever we're talking with clients and we're talking with people who are interested in learning about our programs, we don't use those acronyms, or we shouldn't be, because it can be really confusing. And reaching out and asking for care, both for mental health reasons as well as intellectual and developmental disability reasons, is really kind of hard and sometimes scary for people. So we want to try to make things as clear and easy to understand as we possibly can. So yes, lots of acronyms, but try to keep those under control when we're talking to the community.
Excellent. I appreciate that. And is there a particular program that you can think of that is top of mind, something that you're really proud of?
Well, I run what's called our behavioral health and IDD, which is intellectual and developmental disabilities access hub. And so that's for many people the first step on their journey of accessing care at our
Jennifer, we had a little bit of interference, a little bit of feedback just now. Can you repeat that? Can you run that back again? The name of the program? Sorry. Yeah, go ahead. Thank you.
One of the programs that I run is called the Behavioral Health and IDD, Intellectual and Developmental Disabilities Access Hub, which is often the first point of entry for a lot of folks entering care with our organization. So it's basically a call center that has several different lines that ring into us. We always say no wrong door, right? Like you can call any of the numbers affiliated with our agency. And after hours, a lot of them roll to us because we have a 24-hour crisis line. We have an access line for people that just have questions. We run the statewide COVID mental health support line. We have all kinds of people that are here and ready to talk to folks. You can go onto our website, which is theharriscenter.org, and you can chat with us. So if you're not ready to make a call yet, we have a texting line. And so there's just all those programs kind of run through me. And then I'm able to connect folks with whatever the next piece is, right? So I work a lot with Evelyn and her teams, with our other clinic-based programs, if that's what the caller or texter or chatter is looking for. So we have lots of different ways to get people affected. And that phone number, by the way, is 713-970-7000. So if somebody is looking for care in Harris County, or if they're looking to work for us, you can always come in through our website or chat or call. We'll be happy to connect you with those pieces of
Absolutely.
service.
And we'll have that in the chat as well, so that folks can see that. Give me some things, some ideas on the types of situations you're dealing with in the community, because I think that a lot of folks aren't aware of what some of those things are. So Evelyn, would you like to speak to that? What are some of the things cases that we might even think about that you come across, and how the Harris Center is able to help with some of those situations?
So through Jennifer's No Wrong Door Access Hub, we are able to pretty much help anybody who reaches out for help in Harris County. And so not only do they reach out to us that way, but we have, talking about the alphabet soup, we have an NPC, our Neuropsychiatric Center, which is located at 1502 Taub Loop, right next door on the same campus as Ben Taub. And anybody in Harris County is able to walk through those doors 24/7 and say, I'm in crisis, I need help. And they will be seen by licensed professionals, physicians, registered nurses, and get the help that they need, whether that's linking them to an outpatient clinic, or if it's sending them home with medications, or if they need to stay with us for a few days to stabilize, we're able to do that as well. So at the NPC, we have our PES, which is our Psychiatric Emergency Services, 24/7. Anybody can walk in and say, I need help. On one of the things that I am a new thing with COVID. So as everybody knows, the pandemic has been going on forever now. And when the onset of the pandemic began, a lot of the area shelters closed. And as you know, there's a lot of overlap between homelessness and mental health issues. And so what happened was people who could previously go to a shelter after an inpatient psychiatric stay were getting released to the street. So there was nowhere safe for them to go. And so our CEO, Wayne Young, got with community stakeholders, and we were able to create a whole new program called Hospital to Home, which is currently up and running. It's been going on since April of 2020. And it's for those people who are leaving a psychiatric inpatient stay and they're homeless. They do not have a safe place to go. And so we're able to take them into our facility and keep them for up to 6 months. And that is something that is amazing because we've never had that luxury of time before. A lot of our other stabilization units and residential units are like a 3 to 5 day stay or a 10 to 14 day stay. And it's enough to kind of get somebody patched up, but then we were always able to send them to a safe place, send them to a shelter, send them back home. But with COVID, when most of the shelters closed their doors, there was nowhere to send these very vulnerable people. And so through Hospital to Home, we were able to open up now 34 beds for men and women leaving psychiatric inpatient stays with no safe place to go. They can stay with us for up to 6 months. We do a lot of psychosocial rehab. We link people to not only their benefits in ongoing services, outpatient psychiatric treatment, But we do a lot of community building with the people in our programs. And so a lot of us in this field realize that the people that we serve have been through a lot of trauma. And so in order to help heal the wounds of that trauma, relationship building and connection is always a goal of ours. And so then that way they can learn how to trust and learn how to interact with other people again in a healthy way. And so through hospital to home, we've been able to not only stabilize people again for up to 6 months, but we're able to link them into permanent supported housing in the community. So I think that that's one thing that the pandemic has highlighted, is that need for us to always keep in mind those who are unhoused in our community and how their mental illness will affect the placement options for them as well.
Appreciate that. And, Dr. Collins, get a little bit of feedback here. I'm trying to think where that's coming from. Maybe the ones who aren't speaking, you'll mute yourself, maybe that might help. Okay, so one of the things I wanted to mention from the comments, and this is a great question for you, Dr. Collins, is where does this funding come from? And I know that's a big part of what you do, because you can't do these programs without money, and so we've got to invest some money. So how does that happen? That's what Leon Fress wants to know. He says, where are these funds coming from?
Absolutely. I mean, we can't do what we do and retain our wonderful staff in order to serve our community unless we have the proper financial resources to make this a viable action. And so funding for us is really diversified. We receive funding. A majority of our funding comes from the state of Texas through Health and Human Services Commission. But then we also receive funding from our third-party billing. So some of our clients do have insurance, and we're able to bill for some of those services, those clinical services that we do offer. And a recent thing that has happened at the Harris Center, which is a really great initiative by our CEO, is to pursue heavily securing grants. And so that we go out to private foundations, and we also are really big in terms of research, because some of the interventions that you just heard Evelyn talk about, they're evidence-based research opportunities for us to learn what is cutting edge, what is meaningful to the clients that we're responsible for serving. So that when we're trying to render those services, it is actually received well by the clients. And it's something that really is life-changing for them. And so we like to make sure that we're engaged with those latest research opportunities to make sure that we stay relevant to the community that we're responsible for serving. And that allows us to pursue federal opportunities such as SAMHSA types of grants and other federal types of opportunities. So it really is a diverse kind of fiscal pursuit that allows us to be able to do what we do for the community. And the Harris Center, as Jennifer stated, is one of the largest behavioral health organizations in the state of Texas, with a budget of over $300 million. And so it takes a lot to really get the supports that we need, but the impact is so meaningful to those that we serve.
Absolutely. And so there's two terms I want to make sure that we explain, because some of the folks who aren't aware of maybe some of these things. One is the SAMHSA. I want to, if you can, let us know what that means. I'm familiar with it, but I want to make sure our audience knows. And then also you use a term that maybe some aren't as familiar with, and that's called unhoused, which I actually like that. So can you speak to that, Dr. Collins, as far as the SAMHSA? And then I'll take maybe Jennifer, you can speak to the unhoused.
So SAMHSA stands, and I'm going to try to get the acronym right, and I might have to cheat a little bit, Rollis, to make sure I do
Oh, sorry
that.
to put you on the spot. Just you can tell us what it does if you want to do that.
Okay. But SAMHSA is a national organization whose main focus is on mental health and ensuring that the practices that are across the nation are evidence-based. And so they do allow for many great opportunities for sorry, it's a little bit of feedback, I think, but it's some opportunities for folks to pursue grant opportunities. And it's been one of the great things for the Harris Center, because recently we have been able to secure an assisted outpatient treatment SAMHSA grant, and also a certified behavioral health organizations grant as well. And so it's really phenomenal for a lot of organizations who are wanting to pursue research type of grant opportunities.
Absolutely. And was it Evelyn or was it Jennifer who talked about unhoused earlier? Who was that? Oh, it was Evelyn. I'm sorry. Evelyn, maybe you could explain the unhoused and we'll come back to you, Jennifer. Sorry.
So unhoused is a really nice way of saying homeless, because sometimes it's just transitional. So maybe they do have somewhere to be, but at this point in time, they're unhoused. So it's a nicer way of saying homeless, honestly.
I appreciate that. Go ahead.
I think that this is a really great. We were just talking this morning at one of our leadership meetings about a case that was really impactful, and used quite a bit of the collaboration that we have across this large organization. It started with a call into the crisis line by a gentleman who was unhoused, and he was unhoused due to some pretty, normal things that happen to people, right? Like just kind of stuff happened in his life, and what was really causing his distress and his trauma and his hopelessness that was leading to some thoughts of suicide was that he couldn't find a place that would take him because he had a service animal. And there are many of the short-term shelter-based solutions that didn't have the capacity or the understanding or the ability to be able to have him come with his animal. And so we were able to get this gentleman connected through our mobile crisis outreach team, who could come to him where he was and do a face-to-face assessment, and then get him connected with one of Evelyn's projects, which had the ability to do some short-term stabilization housing with his beloved dog, and then work with him to be able to find some longer-term solutions. So I love that concept again of unhoused in the sense of that, there's so many things that are going on in the world right now that can impact people's capacity to be able to have stable housing, stable employment, etc. So the ability to work across systems like our organization does, to network not only internally, but with the partners that we have in other parts of the county, with other wonderful organizations, our amazing staff who are doing the work, this heroic work every day on the front lines, make stories like this possible with good outcomes and good endings.
Love it. No, it's very, very helpful. It kind of reminds me, there's been lots of times when I was broke. I didn't have any money in my pocket, but that doesn't mean I was poor. I still had income coming in, it just hadn't come in yet. But to me, when you say homeless, it's almost like it's a kind of person, whereas unhoused, it does tell me it's temporary. So that's why I don't know. I like that. I like that anybody can be temporarily unhoused. I think I was temporarily unhoused for about a month. Went to go stay with some friends of mine when I was really young, in my 20s. So I was technically homeless, I guess, for a month. So I love that. I love that feedback. Okay, so we got lots of comments that came in, and I'm going to read some of these. Dr. Rosina Malaska, she says, "Hello, everyone." She's attending from Southwest Texas, Midland. She's Midland actually at the moment, so she's in Texas. Good to hear from you, Dr. Malaska. And then we have, she says, Noelle. She mentioned the point about the unhoused too. She said, I'm trying to find it here. I just saw it come across. She said, "Couldn't agree more, Evelyn. Words matter in how we remove the unconscious bias." And Dr. Malaska said to Dr. Collins, "The research in this area during the pandemic is a wonderful step forward and will be helpful in the future. Evidence-based guidance should, guide the country and the world." So that's great. Thank you for that, Dr. Malaska. And she said to Dr. Evelyn, "That is so wonderful. You all have met their basic needs and made them feel cared for. Kudos." And then, of course, you answered Leon Fress. Leon Fress, he had a question, which you answered about where the majority of the staffing comes from. And hello to you, Jordan, who's also here. We've got lots of folks here that's actively involved in the discussion. Thank you also, Prakash, for your comment. He says nice. And Dr. Malassa agrees. So that's wonderful. All right, so let's kind of move on. I want to move to let's talk about more of these programs. I want to talk about as many of these programs as possible, because who knows, something you share may help inspire another community health organization somewhere else, because we have folks all over the country and the world that will see this. So what's something that you're proud about that you'd like to share that you guys have accomplished with a certain program recently? Jennifer has her hand up. Go ahead, Jennifer. I love it. Go for it.
I do. I have a really, really cool program that I have the good fortune of getting to talk about nationally on occasion. It was the first of its kind in the United States, so that's pretty neat of that happening here in Harris County. But we have a team of crisis responders that are co-located inside of the City of Houston's 911 dispatch center. And the ultimate goal of that team is to catch calls from people who are experiencing a mental health concern, but they don't need police or EMS to come to the scene. They just need to talk to somebody. Maybe they need resources. They need to, or they're just kind of having a rough day and they need to, get it off their chest. So this has been a program that we've been operating here in the city of Houston for 6 years. And we regularly are diverting several thousand people away from law enforcement and EMS response every year. Which is fantastic outcome for the citizen, but also fiscally really great because those resources can go back and help support other parts of the community as opposed to having to go toward that law enforcement or fire response.
I love this. Okay, so because one of the things I love because I've heard about this before. So a situation where someone is having some kind of episode, something's going on with them, and they just need to talk. And in a lot of communities, they will end up getting taken to jail because that's really the only place that they can go. So what you're talking about is there's an intervention there that happens where this person, instead of going to jail, this happens. Is that right?
Not only just not going to jail, but also being able to keep them out of the hospital if they're not going somewhere. So, and getting we call it right-sized care. So a lot of the times we can just de-escalate and serve by talking to the crisis responder over the phone. Other times we send out a mobile crisis rapid response team who can actually go out if the person needs to be seen in person. And then sometimes you heard Evelyn mention one of our crisis emergency centers. We have a 24-hour walk-in emergency center where people can go. But sometimes know what's out there. So being able to talk to us, we can kind of connect them with that. Sometimes people don't need to go anywhere right now, but maybe they want to get mental health care. So we can talk to them about, well, how would you come in for services at the Harris? Or some parent is mad because their teenager doesn't want to get up and go to school. So instead of sending the police out to the house, we can say, hey, maybe we can talk to the kids. What's going on? Is there any bullying happening? Is there something else that's going on? Maybe do a referral to some counseling for the family. But Evelyn has a really fantastic program that is specific to jail diversion.
And I was going to take that segue. Yes, thank you, Jennifer. So we have a mental health jail diversion program. Judge Ed Emmett helped build it years ago. And so it's under our roof at our newest location, 6160 South Loop East. And so our goal is to divert low-level offenders with mental illness from jail into treatment. And so many times unhoused individuals are arrested as a byproduct of poverty. And so I'm not going to go into the criminalization of poverty, but that's a whole nother webcast. But the majority of the people that we serve in jail diversion, they are unhoused and they've been charged with trespassing. And so we don't divert any violent offenses, but by providing stabilization and linkage to ongoing care, we help break that cycle of arrests and incarceration. And by making sure those basic needs, food, clothing, shelter, connection, are met in addition to the mental health treatment, we have some really great outcomes from jail diversion. And people can stay in the jail diversion program, like literally under our roof, for about 10 to 14 days. And then we transition them to housing into the community, where we'll still follow up with them for up to 90 days to make sure that those connections are solid and kept and that they have everything they need to maintain their success. We have a really special part of our workforce here at the Harris Center, and those are our peer support specialists. And those are people with lived experience who work for the Harris Center, but have potentially gone through our own, psychiatric emergency services and things like that. So they've been in the shoes. And it's so powerful for us to be able to have one of our peer support specialists meet our potential guest at the front door and say, "Hey, we're so happy you're here. You know, I was in your shoes, you know, not too long ago," and just to have that genuine, authentic ear. It's so if anybody on the call is a peer support specialist or that resonates with them, you know, we utilize a lot of peer support in our crisis programs because there's nothing there's nothing equal to having somebody who's walked in your shoes before. Um, us licensed professionals, yeah, we're great. We can spout out all kinds of evidence-based practice and you know, but that lived experience, that is just you can't replace that with anything. And so one of the biggest compliments we have is when somebody is graduating from our jail diversion program or leaving hospital to home to go into their own apartment and they're like, I'm going to come back and work here. You know, I'm going to get my certification and I'm going to be a peer and I'm going to work for you. And I love that. That's the biggest compliment we have is somebody believes so much in our program from the services that they receive that they want to be part of it and help transform the lives of others because they feel grateful for what we've been able to do for them and what they've been able to do for themselves. You know, we just kind of
Yeah.
we set things in motion, but they're the ones who make all the big changes. We just help open up doors.
So I just want to make sure I understand this because when I first saw the word peer, it didn't fully register. Because a lot of the, a lot of the orders I've worked on have been more like nurses working out of the hospital. That's what. So anyway, it didn't register for me, but now I think it does. I want to make sure I understand. So let's say I've gone through some issues. Maybe I went through this program, or I was able to get out of jail and get better, or I was able to avert myself from getting in jail by following your program. And so later on, I can actually get paid to help other people do the same thing by being a peer support specialist. Do I have that right?
Yes. And all you do is you share your story. There's certifications and there's training and there's a lot of great things through Via Hope and I'm sure Jennifer Evanthe may be able to give more information than me. I'm seeing
Okay.
a green screen. Is it okay?
I
Am I
think you're
still?
good. Everything's looking good on my side. Everything's looking great. Sometimes the internet kind of messes with you a little bit, and that's the cause of that. All right, so we got
Okay.
lots of comments that have come in. Dr. Malaska, oh my gosh, my heart goes out to Malaska here. Wow, she says homeless brings a whole negative connotation that adds to the mental emotional stress. I was homeless for over 3 years after a terrible divorce. We're talking about Dr. Malaska here. Wow. So you just never know. I didn't know that about her. I know her well. Okay, and so we also Noelle says, "Hi, Noelle," and say hi to Scholar for me. Jennifer Battle, she says, "This is brilliant. I am a CNO in a very vulnerable city and work closely with our community. I'm not sure we have this. Definitely sharing this story and hopefully stealing shamelessly." I love that. Okay. And then Jordan says, Jennifer, this is such a great resource. I hope Houston can set the example and other cities, states accomplish something similar. She says, Evelyn, I'm sure this helps decrease the numbers and overpopulated jail system as well. Dr. Malaska, she says, Jennifer, I agree with Jordan and Noel. This is a great solution to this big problem, not just nationwide, but worldwide. Oh, yeah, I agree. Noel says I have to give you this. Okay, I got to give you this right now. She told me what to do. I'm going to listen to Noel. She says to give you guys this right here. Yes, you guys deserve applause for sure. Okay. She says she'd love to connect with the three of you. Dr. Malaska says storytelling is a powerful way to implement change and foster change. It gives hope, and we must never give up hope. I love this. Okay. Dr. Collins, you can, of course, comment on any of the things I just read, but I want you to talk about to get a program like this jail diversion program. What kind of timetable are we talking about? What kind of resources go into getting the funding for that? Because no funding, no program.
Well, it takes, in our case, it took a lot of work at the state level. Our legislators were in session, understand that this is a serious problem across the nation, and certainly the numbers dictate that it's a problem here in the Houston area. And so funding was allocated at the state level. The state reached out. They understand the great work that's being done by the Harris Center, and they were on board in terms of providing that funding to our staff so that we could implement and support long-term a program like this. And I also wanted to add a couple of, I want to shamelessly sort of talk a little bit more about a couple of other programs that my colleagues did not mention, but I think that it has to go on record. One of the things that's very important for communities, Black and Brown communities, is that stigma tends to be one of the greatest hurdles or barriers that prevents individuals from wanting to access mental health or emotional wellness type of care. And so the Harris Center does a phenomenal job of making sure that we are immersed within those communities so that we could reach everyone, because mental health matters and no one should not have access and resources in order to live to their fullest potential. And so we do a great deal of community outreach. We have specific community outreach teams. You heard Jennifer talk a little bit about co-locations to make sure that we are in the communities and in those significant places where we're visible, and that we're a tangible presence to some of those underrepresented communities. And then we also, work with schools. We work with all of the school districts that are filtered into, I think it's about 21 or 22 school districts in the Harris County area. So we do a great deal of trying to make sure our reach is far in all four quadrants of the Harris County, that we're getting assistance and aid to everyone who absolutely needs it. The other thing, though, that I wanted to talk about is that we also have a great complement of services for individuals with intellectual and developmental disabilities. And so we see folks from birth through geriatric age who might have an intellectual disability, and it also includes autism, pervasive developmental disorders. And so we really work with that population so that they understand their value, how they can be contributing members to society. And we work to develop goals, whether that's employment, independent living, acquisition of skills, so that they can go about and live their daily lives just like you or I get a chance to do the things that we enjoy doing, and date or marry, those independent kinds of life choices that folks who have developmental disabilities are not somehow not able to enjoy some of those same freedoms that you and I get a chance to. But the last thing I also wanted to talk about is a newer program that is under Jennifer, and we were very honored to receive a grant from the Upswing Foundation. We talked a little bit about earlier about how it's so important to make sure your services are relevant, right? So Rollis, for me personally, one of the things I always talk to some of our administrators here is that we can't get into the mindset of being a dinosaur as an organization. So, we can't, I like to call it the Toys R Us or the Sears sort of mentality. They were great giants back in their day, but their model worked 40, 50 years ago, and they failed to revise it to remain relevant and plugged into the community they were responsible for serving. And so you saw what happened to them as a company. So we have to do the same thing, with the social service, but it's still that same mindset, that same business mindset. So what we do for folks in the community has to somehow resonate with them. It has to be meaningful to them. So, back in my day, I'll tell my age a little bit, but it was, you go to maybe a fair or something and you get that trifold brochure, right? And, we look at that, and that's how we got the information about programs, and we read that. Well, those days are long gone. Okay, so you don't give a trifold brochure to a 17-year-old talking about mental health. If you're not on TikTok, if you're not on social media, you're not going to get heard. And so we have to evolve what we're doing to make sure that there's not generational gaps that we're missing for folks who really need our care and understand emotional wellness. So Upswing was able to fund us, and that program went under the great Jennifer Battle. Yay, Jennifer. And so it allowed us to create a texting platform so that we could reach you in the LGBTQ population who might be dealing with a mental health issue. And they're able to reach out via text, because we know how do you communicate now. 90+% of those individuals have smartphones, and that's the medium for which they want to receive communication. So we need to meet it. We had to meet them at that level. And so that's another way that pursuing research funding and pursuing private foundation funding allows an organization to expand what they're doing to make sure that we stay relevant and plugged in.
Love that. Love that. And speaking of upswing, this is what I thought about, this right here. This is what you guys did. With that program, no doubt you just knocked it out of the park. So we appreciate that. Keep up the good work on that.
That should be an Astros player there, Rollis,
was there an Astros play? I didn't even look to see if it was Astros. I just tried to find what I could. Literally while she was talking when she said upswing. So water break time. You got some water? This is good. We get the juices flowing. It kind of keeps the brain going. So I had guests who told me to do this. So that's why we do the water break now. All right. So some more comments have come in. A lot of great ones. And love all the stuff you dropped on us there, Dr. Collins. Appreciate that. Jordan says, I see, I missed so many. I got to scroll back more. Okay. Jordan says to Dr. Malaska, not feeling alone in these situations can be so healing on so many levels, which is so true. That's what your program does. And then Noel says to Dr. Collins, you bring up can I call you Evanthe now? We've been talking for a while. Okay, all right.
Yes.
So Evanthe, she said you bring up a great point. We have to focus on our adolescents who will be the future of our country. Take care of them now so that they may grow to be mentally healthy and successful. Bravo. Jordan says evolving with the times helps break the stigma that goes along with the mental health. Thank you. And it's a lot of minority communities. I know the one I'm in, the Black community, and then of course you've got I've heard South Indians, South Asians rather. They have the same stigma. While speaking to one of the psychiatrists in that area, and she says that exists there. So yeah, breaking the stigma is important. Dr. Malaska says Dr. Collins are truly inspirational. Social media, smart technology is the way forward. And Esther, hey Esther, she says the biggest problem around the country is not the wonderful outreach that is done by all the local communities. They are extensive, valuable, and important. So biggest problem. It's not. Yeah. So we don't have the right outreach. I think I read that wrong. She says they're extensive, valuable, and important. So thank you for that. The biggest problem is having access to appointments to see. She's saying that's the bigger problem, having access to the appointments to see the psych in the clinics, especially where medical management, mental illness is necessary. Behavioral health is 24/7, not 9 to 5, 8 to 8, etc. We need to rethink the clinical brick and mortar standards to meet reality and not rely on ERs to compensate lack of access. So I can tell y'all want to talk about that one.
Woo!
Yes.
The truth. Speaking the truth. Wait, do you have a job? You sound like you fit in well here.
Yeah. Esther's got the right. She's good people. I think she's up in New York or somewhere. She's in New York or somewhere in there. Let's talk about Esther. That. What do you want to comment on that, Jennifer? And then we'll go round robin. So Jennifer, Evanthe, and Evelyn, I want to get each of your thoughts on these comments I just read.
Well, I mean, absolutely. Again, I said access is my number one most important thing that I love to talk about all the time. And it's exactly this reason. You can't schedule your mental health concerns. How many people wake up in the middle of the night where you're having anxiety, you can't rest, there's something on your mind. And so the beautiful thing about a crisis line or a text line or a chat function is that there's somebody on the other end of that, no matter what time of day you call. The case that I spoke about earlier, the gentleman called in like at 6 o'clock on a Wednesday night, and so how many places would they have potentially reached out to that was, an answering service or, something of those lines. But because we're here and we've made that commitment as an organization to be available 24/7, not only did the crisis line answer, but the mobile crisis team answered, and Evelyn shop at the Diversion Center answered, and everybody was here and ready to go and meet the needs of that particular client. As we move forward in a technology-laden world that Dr. Collins talked about, telehealth appointments make the world such a better place. Can we ever, never go back to a place where we had to, drive somewhere in the middle of Houston traffic to get to an appointment, to sit in a waiting room? like the way that we have the capacity that we have now, that was somewhat thrust on us, some of us, thanks to our good friend COVID. We had an opportunity to really learn and grow as not only an organization, but as a community and honestly as a country about what are the ways that we can serve people. And coming back to what Dr. Collins says from an equity lens, from a lens of saying, how can we make ourselves more available to people? Being able to offer 24/7 care, being able to use technology and telehealth, allows people that have shift work or, people that can't take off during those Monday through Friday 8 to 5 hours because they lose hourly pay, that are caregivers, of kids with disabilities or adults that are elderly. All of those things make it complicated when people are trying to reach out for care and put up more and more barriers along the way. So as an organization, we're growing. We're growing our staff because we're trying to learn things, build new programs. We need people that are comfortable with technology. We need people that are ready to jump in, learn new things, paying attention to how they want to receive services, and when they need care, and bringing those ideas back to us as an organization. My favorite conversations with team members are like, hey, what if we did it this way? And I'm like, yes, bring it on. We want to hear your ideas for how we can do better.
Love that. Love that. Okay. So what about you, Evanthe? What are your thoughts on any of these comments?
I think Jennifer did a phenomenal job in laying the foundation for that response. I'll just add this, that as much as we, COVID was a horrible, horrific situation for the world, really. And so I think we have to learn some lessons out of this situation. And one of the lessons learned is it really was a shakeup as to how we conduct business. And for us in the mental health field, as she stated, it really forced that needle for us to move more into telehealth and making sure access remained available. And so as we come out of this pandemic, we can't forget those lessons. We have to make sure that we continue to learn from them and build our service model based upon those lessons learned. Part of also what we have available at the Harris Center is called case management, which includes care coordinators, it includes service coordinators. Even before COVID hit, though, these were individuals who are out in the community. So if you're engaging with our services, and let's say you don't have the ability to come into an office, these individuals travel to their homes. So they're going to meet you where you're at. Whether it's if you want to meet at the park, if that's more convenient for you, if you want me to meet you in your home, if you want, let's say I'm working with your child to teach some type of skill acquisition. And so you need to teach maybe Johnny how to acquiesce the local grocery store and be able to, not pull things off the shelf. Maybe you're teaching a behavioral health kind of technique. We would actually go with the parent to the store to be able to teach those skill sets. So it's not just about the old, I agree with Esther 100%. It's not just about an old model where we're the service provider, so you're responsible for coming to us. This is what we give you, and then, send you on your way. We have to meet people where they are to teach them the skill sets in the communities that they live in, because that's where they're going to need those skill sets in order to flourish and thrive.
Love that. That's awesome. Okay, Evelyn, what about your thoughts?
Going back to the us transforming. So our mission is to transform lives. And I think as we became a certified community behavioral health clinic, we began to transform ourselves. So talk about coming into the now and not just looking at a siloed mental health picture of people. Now we are reaching into physical health care. We are reaching into housing. We're reaching into those other components of wellness. And then taking better care of our staff as well, recognizing the impact that providing this care during a pandemic has had on our staff, because everybody didn't get to go work from home. I run 24/7 crisis units. And so I have people who drive in Houston traffic every day to come to work. And in see people who are coming straight off the street. And yes, we've had some, outbreaks of COVID, and we've dealt with that. And we have people who still continue to come to work each and every day because they're so passionate about our mission. And so I think not only being with the times and with the chatting and with the telehealth options and stuff, but just recognizing the dedication of our staff. I think that's been the best thing to come out of this pandemic for me, is to realize just how much their heart is in it, to put their life on the line each and every day to come and make sure people get the help that they need. So that's pretty much, they said everything else.
Love it. Okay, so I cannot let this show go without me asking at least one fun question. Okay, so who's the brave one who wants to take my fun? This is a would you rather question. It's kind of a fun question. Who wants to take mine first? You're pointing to me. Oh, Evanthe's pointing to you, Jennifer.
Jennifer.
Okay, Jennifer, come on, you can do it. You can do it. Okay. Would you rather be stuck? Okay, no. Would you rather, if your life depended on it, try to estimate within 50 the number of marbles in a 10-gallon jar, or the number of people at an outdoor rock concert? Your life depends on it. Which one are you going to do?
Terrible number accuracy. This was the worst. I would just not make it. I would just cry and sit on the floor. I would call the crisis line. Honestly. Like, I would.
Oh, that's a good one. You call the crisis line.
Phone a friend.
Okay, but if you had to choose, which one would you go with?
I guess people, because I like people better than marbles.
Okay, you're gonna count the people. Okay, got it. Okay. Evanthe, how about you? Which one would you choose? If your life depended on it, would you, within 50, try to estimate the number of marbles in a 10-gallon jar, or the number of people at an outdoor rock concert?
Oh, God. I'm going to choose people as well.
That, you know what? That's in line with what you guys do. You're so people oriented. So let's see what Evelyn's going to say. Evelyn, are you going to agree with him, or are you going to go with something different? What are you going to do?
Depends on who's playing the concert. So, I mean,
who would you want it to be? Who would you want to be at the concert?
oh gosh, can we do like if they could still come back to life? Like, I would love to anyway. So
yes,
I'm easy. I like everything. I was just kidding, but I would count the people, because
you count the people.
I think it's a good thing.
Okay, guys, in the comments, let me know what you guys think. Would you go with the people or the marbles in the jar? Okay, I have a comment that came in, Dr. Malaska. She says, Esther Horowitz, such great points. So she agreed with what she said about the access, which of course I know that was your thing, Jennifer. You're all about the access. She says COVID is not over, and with all the lessons learned, we should continue to evolve with boots on the ground strategies. I'm still travel nursing as a critical care nurse in the pandemic. It's going to get worse as winter sets in. Been on the road as a travel nurse for 26 months now, pandemic nursing for 20 months. Wow. She says, Harris Center for Mental Health and IDD team, you are leading the way in caring for all peoples with mental health struggles. Kudos. So I'm going to give you this too, because I'm checking in with the audience here, and this is my little check-in. They love it too. See, they love what you guys are doing. You guys are awesome. Okay, so we're coming towards the end of the hour. I want you to, if you could speak to CEOs and leaders or legislators or whoever you're speaking to that can make decisions, what would you encourage them to do? Because I know your CEO is doing a fantastic job, Wayne, and his team. They're doing great. And you got a new CMO, which I'm so excited about it, Dr. Lee. So you got that going here. But what advice would you give to any other organizations that are in other areas? What could they do? What's the first thing you'd say they should do, Jennifer, and then Evanthe, and then Evelyn?
Listen to the subject matter experts. And that, you need to fund mental health because mental health is endemic to all other issues. If we have a mentally well workforce and community, then we have a good economy. And so I think those components are so key. Oftentimes we think of funding mental health as an extra thing, and I feel like we should really be centering mental health as an integral part of how our society grows and respects our people.
Appreciate that. Love that. And by the way, Jordan says, I'm yelling Queen at the computer right now, Evelyn. She's thinking Queen. Okay, Evanthe, please share your best advice.
I think one thing I would say to CEOs or any kind of executive leadership, and when I used to work in organizational development, I always had this phrase that your customer will never be happier than your employee. So if you really want
Ooh.
to think about the folks that you're responsible for serving in the community, you first have to take care of home. Make sure that their physical and mental, emotional well health is taken care of, and you build that staff up because they can never give what they don't have. And so if they feel respected and honored and supported, that's going to come out in the customer care that's received in the community. And then the other thing I would just add is to make sure that we now in 2021 are looking at things with an equity lens. We have a great responsibility to serve a diverse community. And so we as organizations need to look that way as well. And that's one of the things that, like you said, Wayne has definitely put in the forefront for his administration, is to make sure that we are representative of the community we're responsible for serving. And that makes a difference because people will want to engage when they see someone who looks like them. So
Love that. So true. Evelyn?
Why do you make me follow these women? So I will speak to other organizations. And so one thing that I love about the Harris Center is we often have visitors from all over the state, sometimes the country. They want to come and see how we do the things that we do to replicate it in their communities. So I just want to give other organizations hope. They can start small. They can find people in their communities who have a common interest. And if they have a carrot and you have a potato, somebody else has a stone, let's make some soup. And so I think that it's really important for everybody you don't have to go at this alone. Subject matter experts, like Jennifer said, and then just, reach out to people who are already doing it, learn from us, let us help you. And then just don't get discouraged. Just keep going.
Love that. Love that. This is great. So I really want to thank all of you for being on here. I really appreciate the work that all of you are doing. And, we would have loved to talk longer and have more of your team on here, but we're just so glad you were able to come. And I'm just going to check in with my audience one more time to make sure they've enjoyed it. And see there, they feel the same way I do. So thank you for what you're doing. Appreciate you being on today. I appreciate all the wonderful comments that have come in today. You guys are amazing. Dr. Molasses says, take mental health issues, especially now with the ongoing pandemic, and incorporate this in all your budgets and funding. It is an essential part of human psyche and overall well-being of a person. Healthy people translates to a healthy community, city, state, and country. Agree with Evelyn. Collaboration is so important. And I love what you said about employees, making sure your employees are happy, and that will in turn carry over to your patients or ultimately your customer, right? So I appreciate that. That's amazing. Thank you. Let's say bye to everyone, but don't cut off just yet. Well, because Joanna let us know when it's safe to cut it off. Let's say bye, everyone. Okay, very good. So Joanna, let me know when it's safe to stop it there. Oh, looks like you got another comment still coming. Thank you all, ladies and Rollis. It's been a fantastic, and the conversation must go on after the show behind the scenes. Bye. Appreciate you, Dr. Malaska. You're awesome. Okay, I think we're safe to do it now. Let me go ahead and. Oh yeah, Joanne says I'm good now. Awesome. Okay, well, great. So, what did you guys think? How was it? This is your first time, right?
This was my first time. Yes, I was nervous as all get out. So.
It was good, but I didn't get to do a shout out to come work for us.
You did. You know what? This whole thing was a shout out. The whole episode was one big shout out.
Years to apply by doing that whole peer piece, because I really do.
That was good.
Yeah,
you did great. I wanted to say, so if you think we sound so great, come apply for one of our jobs.
You do, but you do that without doing it just by you guys being on. Number one, you're showing up. Okay, that's number one. Number two, you guys are so friendly and welcoming. That makes me want to work there. And I think that's what's going to, you don't even have to ask. Now, what I did at the top, I did add the website at the top, but I actually already had it scrolling on the left. You see where it says there is the harriscenterjobs.org. And we're going to be making clips out of this, and we're going to use it for recruiting purposes. So trust me, we will get the recruiting mileage out of this.
Awesome.
Are any of you going to be at the thing tomorrow, the hiring event?
No, but like 4 of my directors are.
Oh, very cool. So yeah, we're looking forward to that.
Somebody, who are your recruiters who are working with us?
On our team is going to be Jordan and Wes.
Jordan, I've heard nothing but wonderful things about Jordan. So thank you for Jordan, because my hiring managers are in love and they're just like, they're wonderful. And please, please, please keep sending us great people. So yeah.
That's awesome. Awesome. And then Wes, you may not have heard as much about because he just started maybe a couple of weeks ago.
Okay. Well, Jordan kind of set the tone. So tell Wes he got to be here.
Okay. Yeah, we'll get him there. We'll get him up to speed. So yeah, he's learning everything. But yeah, Jordan, we're just so happy with the job she's doing. And we also have another person on our team who does a little bit of pre-screening work that you wouldn't necessarily interact with. Her name is Dee. And then of course Leah, she helps kind of do a lot of organizing everything. But yeah, we're learning. We're getting better each day. And this helps too, learning more about your programs that you have. Because sometimes, when you're recruiting, you're just kind of going, oh, rec. This is another rec. We're not thinking about the end result as much. And then, so when you know the end result, it makes us more passionate about it. We're able to find more of the right fit. So this all helps. So thank you for that again.
Thank you. Thank you for the opportunity.
Appreciate
Our pleasure. I'd love to have you guys back on another program if that's okay.
Absolutely. I'm going to tell you, Rollis, we're about to do a big expansion in our crisis line by bringing in 988, which is a national federal policy to equitize people's access to care via a 3-digit number. And we're going to basically be adding probably 20 or 25 crisis line counselors over the next year.
Wow.
So I'd love to talk about that in the future.
Absolutely. I love those kind of conversations, and we can definitely help make sure you have the right staff candidates for that as well. Well, thank you for your time today. Really appreciate your wonderful work and hope to have you back on soon.
Thank you.
Bye.
Have a good one.
Bye, everyone.
Bye.
Hello there, Rollis.
Hey. So how did it go today? Very good.
This is so weird. Actually, I haven't followed the discussion really well because I have been checking this Wirecast, Facebook, and LinkedIn. I see to it that everything looks and sounds good, but the thing is, here on Wirecast, I can't hear them speak. The three of them. I can only hear you every time you speak. So I need to listen to Facebook and LinkedIn to make sure that it's working fine there.
Mm.
Then before the show ends, there's some echo.
Okay.
The good thing is the discussion really went well.
Okay.
If you're maybe at 240, so there's some echo.
Okay, I'll check on that. Was it when I was transitioning from one screen to another? Like from one person to another?
Yes.
Okay. I think I know what the cause of that is. I think I know.
Yes. And then with regards to the delay, it's actually it's almost the same from Wirecast and Facebook.
Oh, so it's like
Listening.
Okay, so there's hardly any delay to Facebook, but the other ones are a delay. Ah. Okay. Interesting.
Delay on the delay is on LinkedIn. Plus there are times I'm not sure if internet connection, but it's very very clear. But if I watch on Facebook, it's frozen sometimes.
Interesting.
And Yeah, it's not clear on my screen, but on
Well,
Facebook it really appears clear.
I'm working on some new hardware, some new hardware and some new stuff that's going to allow me to have more control over the individual audio of each person. I can do some of it through my controls here, but it's going to have even more control where I won't have some of those issues. And also with the delay, I don't know if it'll fix it, but I think it will. I bought this other little device that hooks straight to, it goes straight from this device to LinkedIn without even having to go through Restream. And so that may help decrease some of that delay. So, but I haven't, it's not fully set up yet. So I got to work on that. But
Yeah,
thank,
because I kept on comparing the three on Wirecast, LinkedIn, and Facebook. So there were times, oh no, most of the time, Wirecast and LinkedIn are frozen, but on Facebook, it appears really good
okay. All right. So I have a
from the
question.
beginning to
I,
the end.
I have a question for you. We have a VA position in the U.S. that we're looking to recruit for, and obviously we have to pay. The pay range is a little bit different for our U.S. Based folks, just because of the dynamics of cost of living and all that kind of stuff here. But
Yes.
if we did end up going with the Philippines route, and hired someone from the Philippines, do you perhaps know of someone before we put it out there on Upwork? Do you know of someone that you know personally that would do a good job with some of the video stuff that Jonathan was doing? So it means that they would have to basically be, maybe it's someone who lived in the States for a long time and they're back in the Philippines. Maybe they're from the United States and they live there. But it that is very familiar with kind of the local vernacular of what we use and is able to go through and fix some of the grammar. Actually, we have Melissa for the grammar, but some of the production stuff that you've seen me do. If you know of someone like that, um, I'd like to offer you a little bonus if we find somebody. If you find somebody, for help us find someone for that, because I think if you know them, it would be good.
Yes, I'll try to find one. But that person has to have background on videos, right?
No,
More on videos.
no, I need them to be. I need it's someone who can do the videos, but they can do really anything that has to do with project management, managing projects. So they've had, maybe it's a little bit of a background in managing projects. They don't have to be necessarily a project manager, so to speak, but they've managed projects, and someone who is very, very familiar with the U.S. culture and some of the way, like something might be, you can say something correctly, but it may not necessarily be something that we say it that way here in the US. Just like there's certain things as I'm learning Tagalog, for example, I might learn, magadanga maga, but I might put it in I might not say it the right way, or maybe maybe you don't always say, like, remember something you told me, I asked you about how you say it in Tagalog. You say, well, we just use the English word. And the only way you would know that is if you're from the Philippines.
Yes, yes, that's correct.
Yeah. So that's why I say if you know somebody
I get it.
who spent a long time here, maybe they're back in the Philippines, or they're originally from the US and they live in the Philippines now, that's probably someone who I would probably want to talk to that's in the Philippines. Um, Whereas right now I'm really trying to focus on a US person, but just in case you knew someone there, I wanted to at least mention that.
Okay, I'll try to find one.
But I don't want you to know. But no, I don't want you to think this is a task. So don't worry about it if you don't know of anybody already. Don't. I'm not saying you need to go try and find somebody. If you know somebody, great. If you don't, not a big deal. Do you know someone like that or no?
Yes. All right. For now, I can't think of any.
Yeah. So don't worry about it, because, and by the way, this still won't affect anything you're doing, because we just want to. I really appreciate working with you, and I want to work with you. I mean, and as long as you want to work with us, right? So
Thank you.
yeah, so it has nothing to do with you. But we're just looking to expand because our workload is growing right now. So we need more assistance. We need more help. That's why we're, And then with Jonathan leaving, it's even that much more important that we do it.
Yes, yes, I understand.
All right. Well, thanks for all you do, and thanks for helping today.
Okay. Thank you,
Okay.
Rollis.
Thank you. Bye-bye.